General practice is under enormous pressure from many different directions. Alongside the demands to care for increasingly complex cases in the community setting, GPs are facing increased pressure to address health problems related to patient lifestyle and an aging population. Patients themselves also have greater expectations of what their family doctor can do for them and their availability. At the same time, increased scrutiny from central and regulatory bodies is taking time out of general practice, and running costs continue to rise against fairly static funding. Put these separate and sometimes conflicting demands together, and it's easy to see how general practice is facing a perfect storm scenario, a critical situation created by the pushing and shoving of many factors. We understand that in general practice, this perfect storm can feel very personal very quickly, with practice staff of all types feeling a huge amount of personal responsibility to meet demands and the resulting disappointment, frustration, and stress. But our experience also tells us that one of the hardest types of practice to make change is one that is comfortable. Change is difficult and requires a certain amount of urgency to make it happen. The perfect storm can be the ideal environment to make change. So, with all these increasing pressures coming at general practice from many different directions, what is the answer? Surely not more work. The General Practice Improvement Programme has been created to give you the tools to develop your expertise to enable you to do what is best, providing high-quality, timely care to your patients while balancing resources. And it has been created to be easy to implement within a perfect storm, not work against it. What inspires us is getting it right and recognising that benefits us all. GPIP provides a route to fast, practical and robust changes that will make things better for staff, the practice and ultimately patients. For clinical commissioning groups and other commissioning organisations, it provides a framework for supporting practices and opens up avenues of communication. It is a catalyst for wider practice engagement. We have used our experiences in general practice to create this set of hard-hitting interventions. But we also believe that only practices themselves can define the exact improvements that need to be undertaken. This is because understanding of the local context of your practice is vital. Although every practice may be facing similar pressures, each practice will have different priorities and issues that need to be addressed. Through GPIP, we will work with your practice and other stakeholders to understand the exact local context to create an exact format of interventions with you. This means you own the process, rather than it being done to you. So, what do we do? Improvement experts will carry out 12 half-day visits to your practice over a 3-month period and cover 5 main work areas. These visits are designed to fit in with the day-to-day running of your practice. The schedule will detail exactly which staff need to be available for each visit, so your practice can plan in advance. Each visit will look at 1 or 2 of the work areas. During these visits, you will receive practical, not theoretical guidance. Together we will get our hands dirty and make improvements there and then for each visit. The visits will be informal and fun. Expect lots of debate, laughter and progress. There is no homework. Each visit is structured around a GPIP brief, simulate, do cycle. As part of GPIP, you will receive workbooks for each work area. The 5 main areas are based on best practice techniques from healthcare and other sectors. Many are sourced from lean thinking. Your practice is provided with additional support through a telephone helpline. For a year after you begin GPIP, you will have access to an expert in the techniques along your GPIP journey.
The nice thing about this was that it gave us a way to look at this huge problem quite quickly and succinctly with a process.
The 5S module with the practice nurses looking at clinical rooms, they really enjoyed that, and it was good because we got a mix of nurses who don't normally work together working across all the surgeries on that, so that was nice.
The facilitators worked really well. Tim, who worked with us, had come from an NHS background, and you would think that he'd worked in general practice a lot actually, because he really did seem to understand the issues that we had.
I think the background that you and Nick had coming in made sure that there was no fear element at all, and we felt we were dealing with fellow professionals. So we weren't ever made to feel that what we were doing was wrong or inadequate or anything like that. All the time it was encouragement that actually that's good what you're doing, but we've got some tricks here we can show you that if you start working your processes this way, sharing your expertise with us, and also with having an understanding of general practice, how that could work for us, we can make it really good, and that was just fantastic for us.
The nice thing is we can expand that up to look at different processes, but using the means and the ways that we've learned from doing these certain areas.
For me, one of the greatest strengths really has been the sort of team approach and the actual sort of understanding of different people's roles. So I think in a busy surgery it's very easy for people just to kind of get on with their own work, and sometimes perhaps we don't understand what each of us do and the pressures that we are all under. So I think it's brought us all closer together, and it's, you know, sort of broken down some barriers and probably more informally just improve working relationships. In terms of sort of payoff, if you like, of this, I think that there's obviously patient care is at the forefront of everything that we do, but I think ultimately it makes it a happier place to work, and I think that through that people feeling more empowered, more valued perhaps, and feeling that people understand their own challenges makes it a happier place to work, which then translates into people doing a better job and therefore it being a better place to work.
We've had the groups of people working together in a very different way. So doctors and nurses work together in clinics seeing patients, but actually to work together looking at potentially a spreadsheet and questioning what they do and why we do things was really good conversations. Because they were guided conversations, it wasn't your ad hoc chats over the kettle, it was much more of a like a formal structure, in a way that I was able to get an insight into some of the things the nurses were doing and why they were doing it that I would not have been aware of before. And I think that was an eye-opener for the GPs as well. And also then for us to think, well, the solution is working together on it. So it wasn't me coming out with anything or the partners, it was actually much more everybody engaged coming up with the solutions.
I think just the fact that we've had time to actually stop and talk to each other about it, which has been, and actually decide what we want to do and how we think things should be done ourselves, rather than just dashing from one job to the next and not having time to do that. I think that's the biggest thing, is the fact that we've had the time to actually talk, whereas normally the phone's ringing constantly and you don't get time to do it. There's always something waiting to be done.
Walking around the different areas within the surgery, there's been a feel that some ownership of all of these different pieces of work. I know Sarah, the practice manager's worked very, very hard in terms of the kind of behind the scenes making this happen, making sure that we are where we need to be, and obviously we've got cover and everything else. But I think actually sort of taking this forward, I think everybody has seen the benefits of this and they actually feel ownership of it.
The team behind GPIP were also part of the team behind NHS Improving Quality's Productive General Practice programme. In addition, the team behind GPIP have all worked either within the NHS or for the NHS for many years, providing expert improvement guidance for many different health and social care settings. Our core themes and techniques stem from best practice operations management and lean techniques. These techniques, often from other sectors, have been proved in healthcare and provide huge benefit to organisations, so ensuring clinicians and social care professionals are unhindered in their work with patients and service users, whilst making use of safe and efficient processes.
I would wholeheartedly recommend this process to other GP practices, and in fact I already have spoken to a lot of GP friends about it because I've been so excited about the potential impact on our workload.
If I was to talk to another GP about getting involved with this work, I think the first thing I would do is acknowledge people's worries and concerns, really. You know, I think we're all very busy, and actually the thought of taking something else on is always perhaps a little bit daunting. What I would say to them actually is that for not just the work that you do within the sessions being very positive, it's actually much wider than that. And I think, again, we keep talking about this having some space and having some time just to kind of take a step back from what we're doing in our busy daily lives to look at ways that we can make things better for our patients, of course, but also for the wider practice. And I think as a payoff, you know, the time invested in these sessions has certainly paid off tenfold.
Make our life easier and make the patient experience better as a result of it. Give it a go.
You need to give yourself the time. It's no good just trying to shoehorn this in, and that might mean that you need to say no to other things for the period it's running. But I would say it's well worth it, and you'll get paid back for doing that. You need to have your partners on board because you need to be engaging other members of staff with it. I would say if you try and make it as a launch event that this is something really exciting that we're all going to benefit from, then people can't help but get involved with that. And I think also if you share with them what you're doing right from the start, so they're engaged with it. So I involve people with our expression of interest. So right at the beginning, before we even know if we'd be successful or not. But yeah, I would say go for it, it's well worth it.
You can get benefits out of it, definitely. That as long as everyone's on board and willing to take on and work through the things that we discussed, then there are definitely benefits to be gained from it.
I would say first not to be frightened of it, because I think as professionals we can get a bit defensive sometimes, and the whole process, as I said previously, has been totally non-threatening, and it's been about helping us to improve our practice. And we can all improve, we can all think we're doing a fantastic job, but there's always room for improvement. So I would say to people, don't be afraid of it and see it as something positive that you can do to help yourselves and your patients.
The CCG were looking to push out to practices. We were already in a period of change. We were having a new IT system rolled out. The staff were in on change, and I thought this is the time to strike. This is going to be a great benefit to ourselves. This is how we can take our practice forward with the new IT system and look and further develop our working practices. With the help of the programme, we're now one step away from the final chapter of that, and I must admit we are in a very, very, very good, better position, better placed, and have a more professional outlook on the way that we do our day-to-day business, be it from the senior partner right down to the receptionist. Everyone has ownership and believes in part of the business, and with that was a great help from the programme that came in to help us deliver.